Okay, I will make a start. So yes, hello everyone, very warm welcome to today's Money Guiders Scotland Network event. It's brilliant to have you all with us. If I'm an unfamiliar face, my name is Heather O'Rourke and I'm the Money Guiders Scotland Community Network Manager. And I'm really pleased to be opening today's session as part of the Scotland Network, which is above all a community of practice for anyone involved in giving money guidance. So that could mean you're helping with budgeting, could be benefits, savings, planning for the future, you name it, whatever your role, if you're supporting people and their financial lives, you're 100% in the right place. For today's session, don't worry, I won't be doing all the talking. You'll be glad to know I'm going to hand over to two lovely folk from Cyrenians and the Scottish Frontline Network. But just whilst we're here and before I do that, I'm just going to remind you about Money Guiders and the fact that the Scotland Network is part of the UK-wide Money Guiders programme, which is led by MAPS, Money and Pension Service, so MAPS for short. And really, the Money Guiders programme is playing a big part in helping everyone make the most of their money and pensions. And the reason why it plays such a big part is because it's helping essentially it's here to help your learning and development to support the people who are on the ground having those important conversations with folk every day. So if you've got any questions about the network, you've got any suggestions, anything at all, please don't hesitate to reach out. This is your community after all, and we want to make sure that we're taking your thoughts, your feedback on board and delivering things that are meaningful and impactful for you. But yes, without further ado, I'm going to stop sharing my screen and I'm going to introduce with absolute pleasure Ursula Hofeldt and Mike Wright, who I will say come on and share your presentation and give yourself a wee introduction. Yeah, take it away.
Thank you so much, Heather. We'll get the slides up. And thanks so much for having us. And it's nice to see so many people in the room today. We are from Cyrenians. We'll have a little chat about who we are and what we do. And the plan is to kind of cover a few different things around homelessness and homelessness prevention. And I think what we really want to get out of today and for you to get out of today is thinking about the people that you work with and the situation you're in and the conversations that you're having and how you're potentially supporting someone at risk of homelessness and how you might be able to kind of think about that a little bit differently. But we're also going to talk about the current state of homelessness in Scotland, some of the challenges that we're facing with the housing emergency, and things around like what are the causes and consequences of homelessness, what are some of the early risk and warning signs that you might be seeing in your roles. So that's according to the agenda. We'll introduce ourselves first as well. I think I actually flipped the slides around in my own file, but I'd already sent them over. But I guess I just wanted to say we'll have some time for questions at the end, but also please, if you have a burning question, we're not that many people, pop your hand up and we can just do it on the go a little bit as well. Just, I don't want people to be distracted if there's one thing that you really want to ask. So yeah, pop it in the chat or pop your hand up. And otherwise we'll have like 10, 15 minutes at the end, I think, for a bit of a conversation. So I'll let Mike introduce himself first and then I'll come in.
Good morning, everyone. My name is Mike Wright, and I am the Senior Home Services Manager at Cyrenians. Cyrenians is a charity that takes a public health approach to homelessness prevention, and we are based in the East Central belt of Scotland. We've got 60 services and just under 200 staff. And our ambition, as you can see on the screen, is to tackle the causes and consequences of homelessness. We do this a number of ways, through learning from lived experience, by delivering services which are targeted on areas of sort of prevention, early intervention, and supporting people into a home, and finally by influencing change around about legislation and policy based on what we've experienced through delivery of services.
Brilliant. Thank you, Mike. And my name is Ursula. I'm Policy and Participation Manager in Cyrenians. And my role is very much to facilitate opportunities for people who work in frontline roles and people with lived experience to come together and share learning and share experience and try and communicate that up to decision makers, influence policy, try and influence some of those bigger systems changes. And one of the ways that I do that is through the Scottish Frontline Network, which is kind of similar to the Money Guiders Network, but more around homelessness and homelessness risk. So it might be relevant for some of you, might not be relevant for everyone. But what we do is, facilitating events and training sessions, very similar to what Heather does. And that's kind of how we met and linked in. So it's a regular opportunity for people to network, share expertise, and link into decision makers. So there'll be some resources at the end and some links if you want to link in with our network as well. Brilliant. Mike, I can see it's not full screen right now. I don't know if that's for everyone or if it's just me.
Yeah, I've sort of, I'm sorry,
sorry.
I'll maybe try doing it again.
It's always Teams. I do a lot of online events and there's always something that goes wrong. Jacqueline, sorry, I can just see in the slides, in the chat, do you have a question or is that just a little reaction emoji?
I think it might just be just a wee hello.
Yeah. Excellent.
If anyone does have questions, please feel free to use the raise your hand, and I would ask you if you could do that, because when you're looking at a gallery view with lots of people on, it can be difficult. So ask questions in the chat or raise your hand, and we'll catch you that way.
Yes, absolutely. Yeah, thank you, Heather. That that is what I meant by raising hands. I've also done way too many online things.
Okay, so I guess when we're thinking about homelessness and a sort of a definition around about that, we quite often think of people who are rough sleeping. It's easy to be drawn towards thinking about people who are in sleeping bags or in tents, but actually the problem is far bigger than this. So what I've got up on screen here is the Scottish definition of homelessness, and you can see it's a preventative definition. So the first couple of points probably make quite a lot of sense in that it's around about someone having no accommodation in the UK or elsewhere that's suitable for them to live, and equally that it would be somewhere that can accommodate their entire household. But there are many situations where somebody on the face of it may appear to have accommodation, but is also actually statutorily homeless. Now, the first of these is that the person cannot gain access to their accommodation. So if you think about situations like floods or where there's been a fire, for example, that although somebody has accommodation, they're not potentially going to be able to live in that, it might not be safe to live in, and so they require some kind of accommodation support, some kind of homelessness service. Another one that is very common for us, sadly, the work that we do on the sort of the streets, so that we encounter people who've maybe been accommodated, have been given a tenancy of their own, and at some point during that they've experienced some kind of threat of violence, and in their minds the safer option of the two, rather than remain in the secure housing, has been to leave that and go and live on the streets of Edinburgh, of Glasgow, of one of the sort of the bigger cities, because they feel that that's the safer option of the two. And that's someone who, I guess, although they technically have got secure accommodation of their own, is statutorily homeless and could benefit from some of our help around there. It can also cover people in mobile homes or boats, caravans, etc., where there's no place to pitch and moor that. Homelessness includes overcrowding. This is something we see increasingly nowadays, where maybe people have technically got a room or a flat of their own, but it in no way is suitable for, say, a larger household. It has no way of sort of meeting the needs of those people. It's somewhere that might not be permanent, or somewhere where it might not be reasonable for people to continue to live. One of the major drivers of homelessness is relationship breakdown. And so, for example, if someone may well have housing in their name, but it might not be possible for them to continue to live there because there has been, some sort of breakdown in the current living arrangements. And the last point there is around about if the person is at risk of homelessness and whether they'll face homelessness within the next couple of months. Now, we're going to do a bit of talking today about what might change around about that. Could this potentially be extended up to 6 months? And I guess why we would see that, is, without going into it too much at this early stage, why we'd see that as being quite positive, is it's a much more realistic time frame to be able to intervene and help to prevent someone experiencing another episode of homelessness. So this next slide is actually a really helpful slide for me because it contains the most extreme and visible forms of homelessness at the tip of the sort of the iceberg, but it also shows the less obvious forms of hidden homelessness too. Some of the things, for example, like squatting or living in a non-residential building, that might mean that you're actually having to go without many of the basic facilities that you or I take for granted. Again, living in a hotel, it requires you to live in one room rather than in a full home. Perhaps that's fine for a week or two, but not really for much longer periods than that. Again, sofa surfing here and there makes it difficult to register with a GP or to be applying for jobs or, some of these challenges. And bed and breakfast accommodation can have curfews that make it difficult if you're looking to work shifts, for example, and you're not able to come back at kind of conventional times. So pulled out a few statistics from the most recent published homelessness statistics by the Scottish Government, and you can see there the first number shows that we've had an increase again in the number of applications by 4%. There's a 3% rise in households assessed as homeless through that process. Households, and the TA stands for temporary accommodation, and I'll explain a little bit about what that is and just once we've got through these numbers. Households in temporary accommodations increased by a further 9%, a really sort of galling number of over 15,400 children experiencing homelessness, and an average time in temporary accommodation of 226 days. And just, look at that difference in only 4 years. It's gone up by, what's that, 38 days. So when you present as homeless to your local authority, they will do what's called a homelessness assessment. And that is really about answering some of the questions in the slide previous, 2 slides ago, actually, where I looked at all the ways that you could qualify as homeless. They'll look at whether you've got somewhere that you can occupy yourself. And if you haven't, the local authority has got a duty to provide you with temporary accommodation until such time as permanent accommodation can be sourced for you. Now, temporary accommodation, that name is actually a bit of it's not quite reflecting the reality at the moment, because in many of the big cities, the stay is years now rather than months. And so things like hotels, hostels, etc., which might have been a perfectly adequate solution for a very short period of time, are now having a significant impact on people's lives because they're having to live that way for years at a time. There's a few more stats that I wanted to just sort of pull out. Most recent round of stats, there were 1,785 people as reported that they were rough sleeping in the 3 months prior to their homelessness application, and that amounts to 9% of all people who applied. And furthermore, 1,198 people reported rough sleeping the night before they had their homelessness assessment, which is 6% of all applications, and that's a really, really high number. Households and children in temporary accommodation as of the 30th of September 2024 was the highest since we've started measuring it. It's only going one way, it's going up. And even more sadly, there were 7,545 instances of households not being offered temporary accommodation when they were entitled to it. And this is really because there's a lack of capacity within the system. We're at breaking point, and people are not being offered the sort of the emergency response that they're actually entitled to through law. We have now a quarter of of Scotland's local authorities have now declared a housing emergency, and that is really around about that ability to respond to people presenting as homeless, but also having the right amount of move-on accommodation that allows people to move out of temporary accommodation in the first place. We've got a real logjam, I think is how I would describe it in the system. You've got a temporary accommodation system that's completely overcrowded and insufficient permanent accommodation to meet the needs of the sort of the growing population. We've also got a huge number of people rough sleeping. I've sort of alluded to it in a couple of the figures there. Our headquarters is in Edinburgh, and we have a fairly regular count of people who are rough sleeping. Now, it's not a foolproof methodology by any means. It's really a team of people that go out at night and try and count people that are visibly rough sleeping. I know if it was me, I would be trying to probably hide away somewhere, because we hear an awful lot of tales of people being exposed to abuse and to violence and what have you. But just amongst those that are visibly rough sleeping, the current numbers in a city like Edinburgh is around about 80 to 100 people sleeping out, which is quite a horrific number. So we're in this sort of perfect storm, I suppose. Housing emergencies, we've got a sort of a really high number of people sleeping on the streets, incredibly high numbers of children and families in temporary accommodation, and nowhere near enough permanent accommodation to move on to. I'm going to pass you on to Ursula, who's going to talk a bit about some of the causes and consequences.
Thank you so much, Mike. Yeah, so that's kind of the really sort of crisis emergency situation that we're finding ourselves in, and one of the things that Cyrenians as an organization is trying to raise more awareness of is how we can, stop people from ending up in those situations, and how can we kind of try and flow the number of people going into the homelessness system, because of that it is at that breaking point. So some of that is about like raising a bit more awareness of the warning signs, and kind of trying to step in with support at an earlier stage before someone is in that really sort of acute housing crisis. I've put out a bit of a list here. It's by no means an exhaustive list, but these are some of the, I guess, warning signs that you might spot in your own roles. Some of them are quite, you can see the direct link to housing. So there's things like disrepair or rent arrears, or it could be, someone's had a change in their health or their mobility, and potentially their housing is just not suitable anymore. Some of the things are a bit more indirect. So Mike did mention relationship breakdown, which is something that we see especially a lot with young people and youth homelessness, or it can be, just people generally feeling isolated and lonely, and maybe not being connected to the community, which makes it a lot harder to kind of, keep your home and maintain your tenancy. And this obviously doesn't mean that everyone who experiences one of these things is going to be at risk of homelessness, but it will depend on their context, their individual situation, what kinds of protective factors they have around them. So whether that's, savings or just a bit of a safety net financially, or if it's about relationships, which is one of the really big protective factors against homelessness, having a social network, people you can, rely on. But it's also about what support is around them. Are they aware of the support that they can get? Are they aware of what's available in their community? And around the timing, so are we able to step in and offer the right support at the right time? Or does it come, 4 months too late, where there's not really much that could be done other than going in and getting assessed as homeless? So I think, this is just about thinking about the wider context, and very much around how housing and homelessness can be this end result of a series of events and circumstances that we maybe don't always connect to homelessness when we think about homelessness. And obviously, like, poverty is a really big driver of this as well. And there's quite a lot of these points here that links to money, and that could be, some of the support that could help would be kind of debt and money advice, maybe income maximization of some sort, people being able to get the benefits that they're entitled to. So that's really relevant, I think, to a lot of what you people are doing in your roles and in your communities. But there's also other things like, offering family mediation if there's a young person who's been asked to leave the home. Is this actually something that can be, mediated? Is it something that can be a bit more planned rather than like a crisis situation? Can you plan for like a slower move out period where the young person is actually able to find the right housing option, maybe over a couple of months? Or is it about like, people having support, being linked in with community activities, or just, there's so much. And I think that is really like the main thing, is that everyone can actually play a role in preventing homelessness. And I would say probably a lot of what you're doing is actually, a part of that sort of puzzle. Next slide, please, Mike. And I also just wanted to highlight some of the kind of key transition points that we know from our own practice and service delivery, but also from research, that are really key, where there's a really high risk of someone becoming homeless. And this is particularly when people are leaving any kind of institution where they've been housed for, any amount of time. And that could be someone being discharged from hospital, could be someone leaving a mental health ward, it could be someone leaving prison, it could be a young person who's aging out of care, so they might be leaving the foster family or a residential care home, and suddenly finding themselves, with not a lot of support and no family ties, and kind of ending up in that kind of youth homelessness space. Or it could be people who have been staying in home office accommodation, and I can see I've got a spelling mistake on my slides. It meant to say accommodation. So if people get their refugee status and they actually able to stay in Scotland, often people are asked to leave really quickly with a very short turnaround time, and then asked to go and present as homeless at the local authority. And a lot of what we've seen in Glasgow is that a lot of pressure on their homelessness service, because a lot of people are being dispersed to Glasgow. And again, that is absolutely right, and people have the right and they should stay here, but it just means that the system is just under a lot of pressure, and there's not a lot of prevention in that space around people who are able to stay in Scotland and make it their home. So yeah, it's just all about having those pathways in place and really sort of think about these key transition points where people can fall between the gaps, because you're moving from one system to another. And some places, that communication, those pathways are absolutely there, and there's a lot of good practice around that. But it's not always consistent. It's not always the same across the country. And something that, like in my type of role, is like very much about kind of trying to identify those good practice and pockets of good practice, and thinking about how can we expand this? Can we do this somewhere else? And Mike is going to talk a wee bit about some of the services that Cyrenians has that actually try to work in some of these spaces and kind of provide that link, so that we don't lose people when they're leaving an institution. Thanks, Mike.
Thank you. So, yeah, I think as Ursula sort of touched on it, Cyrenians, we realise we cannot just continue to work with people in housing crisis. We've got to work further upstream to stop people entering homelessness in the first place, really. And that's why we decided to take a public health approach to homelessness prevention. So we've actually grouped our services under prevention, early intervention, support into a home, 3 categories that we feel are well placed to, I guess, to try and avoid people entering homelessness and maybe get a bit further upstream and start to, I guess, to sort of turn off the taps a little bit. So one of the services we operate is actually a national sort of best practice initiative, and it's called the Scottish Centre for Conflict Resolution. And it's really building on that understanding that relationship breakdown is a major driver of homelessness. So it seeks to work with parents, with families, with teachers, with youth workers, with any sort of professionals who come into contact with young people and their families, and with a view to developing some skills in conflict resolution. So that can take the form of things like workshops in classes, in youth clubs. It has an awful lot of online resources that are actually accessed nationally and internationally. There are web chats, there are all sorts of resources, I guess, that help to deepen people's understanding of what conflict is and how maybe to pick up some skills to acknowledge that conflict is part of life, but also that how we can sort of move away from that and not have it be such a sort of a key impact upon people's lives and a driver of homelessness. We also, in the sort of the early intervention space, we deliver community link working. Now, community link working is a sort of a Scottish government strategy, so it's present right across the country. Our particular parts of community link working are delivered in Falkirk and Edinburgh. And the reason that we're particularly invested in community link working is community link working itself is about providing social support to people when they go to the GP. You know that if you go to your GP, they don't necessarily always have the answers, and it's not always easily answered by the medical model. And sometimes people actually need some social support alongside the clinical support that the GP and the staff, the clinical staff, can offer. So we feel that the link worker alongside the GP or the nurse or the psychiatric nurse can offer a much more holistic offer of care. But we also, there was a pretty seminal piece of research done by Dr. Andrew Waugh, which showed that one of the predictors of homelessness was that people can have quite a flurry of appointments with health services right prior to their presentation as homeless. I think it's around about 7 presentations on average before an episode of homelessness. So it really makes sense to us to be to have something that's embedded in the GP practice that's, I guess, that's taking a wider look at people's circumstances and offering a much more wide range of support that might help them to avoid homelessness altogether. And then the third example I was going to pick out in the sort of the support into a home, so almost at the crisis point, if you like, is our hospital in-reach service. We have a hospital in-reach service which works in the 4 acute hospital sites in Edinburgh, and it is based on, excuse me, we have an algorithm which, when you're first admitted to hospital and you give your address details, if your address is one of the over 500 addresses used in Edinburgh as temporary accommodation, then the algorithm flags up, well, this is somebody that would benefit from the hospital inreach team. And we get a daily report delivered to us sort of at 8:30 in the morning, and we can have a staff member by that person's bed that morning. We always have somebody by that person's bed that morning. And really the idea there is that we can make sure that the person has got everything they need to remain in hospital and get access to the sort of the care that they need. But we can also start to begin to plan for what a good discharge might look like. And a big part of that is obviously having the right kind of housing. Somebody's housing needs may even change in hospital because there may be a change to their mobility, there may be a change to how they access facilities. But there also may be a need to have access to some community-based services, whether that's around about money advice, whether that's around about mental health support, whatever that is. These are all good things that are going to help people, I guess, to live their best lives, but also to recover well, and crucially not be representing back to hospital again, because we have seen over the years a number of times where people almost pinball between hospital and the streets, hospital and the streets, because no matter how good the course of treatment is, it's very, very hard to recover if what you're going back to is inappropriate housing, or worse still, a damp street or car park somewhere. So I think I'll pass you back to Ursula now.
Thank you, Mike. And I just saw there's a comment saying the hospital project sounds fabulous, if only that were nationwide. And I think, that it really speaks to this thing around like there might be really good local practice. But I think we are trying to do our best to sort of try and, I guess, do a bit of research on that project around what works and see if there's any way that could be, delivered in other settings. Not by us, because we won't necessarily have that local knowledge, but I think there's definitely elements of that project that you could place in other parts of Scotland and sort of, so we are trying to draw out that learning and hopefully share that with the right people. Brilliant. So I don't want this to become a very policy focused presentation, because that's not that interesting to everyone. I guess but it is quite relevant when we talk about homelessness and homelessness prevention, that there are some new legislation passing through Parliament at the moment that is going to change or impact how that is working in Scotland right now. So we thought it would be relevant to kind of make you aware of that. I don't know how many people already know about the homelessness prevention duties in the housing bill. If you do you want to pop your hand up just so I sort of know how to maybe pitch the presentation a little bit? If it's completely new for everyone, then that's great. I'll explain it. There's a couple of hands. Excellent. All right. Mostly Jacqueline. Oh, okay, that's good. it's one of those things when you're in the homelessness sector. We have talked about this a lot the last few years, but sometimes you go into other settings and you're not entirely sure how much people are aware of. But I will do a bit of a presentation. It's not going to be about the nitty-gritty of the legislation. It's more about the kind of principles and what that can look like in practice. But yeah, so new prevention duties, they're part of the housing bill that's going through Parliament right now. The housing bill also contains lots of things around rent controls and like the private rented sector and protections for tenants. So it's a really big kind of unmanageable bill that has a lot of different aspects of it, and it's taking a lot of time. And I think potentially the prevention duties has been overshadowed a little bit by some of the other maybe, I don't know, controversial or newsworthy types of legislation like rent controls. But the duties are very much like, the idea is very much around how can we, take a few steps back? How can we kind of identify people at an earlier stage, like we talked about previously? And it came from the homelessness sector. It came from people with lived experience trying to think about, what could have stopped your journey on homelessness? Like what were the opportunities where you would have needed support, where the right support, if that had been in place, that journey might have looked different. And the concept of Ask and Act came from a lived experience group that was influencing the kind of policy development at that stage. And so, yeah, so it really is about moving from that very like crisis stage and trying to think a few steps behind. And the way that the legislation is trying to achieve that is in two ways. So one is introducing this concept of Ask and Act as a duty on different public bodies. So that's going to incorporate things like health, the justice system, police, education, care, Social Security Scotland have been added to the list as well. So it's basically broadening the net of who is aware of homelessness risk and who might be in a position to pick that up. Like Mike said, all the research around kind of journeys into homelessness show that there are all these like kind of potentially missed opportunities, all these presentations with other statutory services, especially health, right before kind of a homelessness presentation. So that's one side of it. And then the other one is around currently, as Mike said, the current sort of definition around homelessness or threatened with homelessness is that you're 2 months away from homelessness. And the legislation is trying to move that back to 6 months. This also, it maybe sounds a bit arbitrary, but I think again, the spirit of the bill is that rather than waiting until, someone's 2 days away from eviction, work needs to start earlier. So the duty around extending the kind of period is very much focused on the local authorities in terms of kind of having a duty to start prevention work early. And that doesn't mean that they're not already doing this. Again, prevention work is already happening across the country. It's not a completely new concept, but it's not as sort of legislated for in the same way as the more sort of crisis end of homelessness. So that's very much what the bill is trying to do. And I'm not going to talk too much more about policy. But I guess just another sort of important thing that Cyrenians sort of keeps making in this conversation is that third sector organizations and support services and community organizations are going to be absolutely key to make this work in practice, because a lot of the support that people are going to need is often not being delivered by a public service. It's often being delivered by the third sector. So there's a really key piece of work around how local kind of networks of support feed into this and the referral pathways that need to be in place. And as well, communities and community organizations are very well placed to spot these early signs because you're already having those conversations, which I'll talk about a bit more later on. Next slide, thank you. So obviously with any kind of policy, there's good intentions, and then there's the reality. And as we just heard from Mike, the housing situation and homelessness situation in Scotland right now is really challenging. So this is going to take time. It's not something that it's going to work from day one. It's going to take a lot of implementation, a lot of engagement with stakeholders, figuring out how to make it work. as part of the Scottish Frontline network, we did a lot of engagement with frontline workers across lots of different public bodies like education and health and justice, to kind of learn from them around what are they doing already, what's maybe working well, and what are the barriers that they foresee with this new legislation. So I just wanted to highlight some of those, just to show that we don't think, it's just all going to work flawlessly right away. And I'm sure a lot of these challenges are going to be very familiar to you, almost regardless what setting you're working in. But yeah, so obviously no surprise, housing shortage, lack of suitable housing is going to be really key, because as Mike described, if you have this bottleneck in the temporary accommodation system and nowhere to move people onto, it's going to be really difficult to prevent homelessness as well, apart from if you can keep people in their existing homes. But if they need to move because of whatever changes in circumstances, that's really going to play a big part. And there's something around what are the reachable moments, what's the right time for people to get support, and how do you really make the most of those opportunities and those kind of presentations to other kinds of services and support. And a lot of what the feedback that we got from people who are not necessarily working in the homelessness space is that, like, maybe a bit of lack of awareness of the triggers or the early warning signs of homelessness, or not knowing kind of until someone is maybe at risk of rough sleeping, not necessarily knowing that that's the path that they're on, and maybe being able to step in earlier. Then obviously, as I said, what's going to be really important is what is the support provision in each local area. And that's, again, it's going to look different. It's not consistent. There's going to probably in the bill, there's probably going to be some kind of mandated services that local authorities will need to kind of deliver or commission as part of this bill, to make sure that, they have a few things in place that people can get support with. But again, right now, it's not necessarily that consistent. And also this kind of, always talking about join up working, clear referral routes. If you identify someone at risk, what do you do with that? Where do you send that concern, that referral? Do you signpost? Do you have like a nice clear pathway into another service that can help? And that's going to be really key to actually making it work in practice. And then there's the thing, all the public bodies, everyone who works in them, they all have very specific outcomes that are very important, whether that is health or whether that is safety or education or school. I think housing is just not necessarily considered as a priority, and it's maybe seen as this sort of thing, the periphery that, but that's fine, that's not our responsibility. We're not housing experts, we're not, housing officers. But actually, this is about trying to recognize the role that we all play, and the role that homes in general play in people's health, in people's well-being, in people's ability to maintain a job, in people's ability to link in with their community, and just having a much sort of, awareness across the public sector around the importance of housing. And then obviously a big challenge right now, I'm sure lots of people can recognize this, a lot of funding pressures. And at least what we're seeing is a lot of pressure on actually the services that are quite preventative, because there's so much happening in the crisis space and there's so much pressure, that a lot of the services that actually play a key part in, supporting people to stay in the homes, those are the ones that are being stripped right now. And that's something that's really concerning, especially if we're having this new legislation coming in the next couple of years. But it might also be something that hopefully can help maybe protect some of that funding. Next slide, please, Mike. So again, something that people will ask is like, how do I ask the question? How do I broach this topic? And I think just as I was looking through my note, I was like, I just wanted to say, don't overthink it. Like, I think everyone who works with clients or people, you'll be having really difficult conversations all the time, whether that is about money or budgets or death or gambling or anything. It's really not that different. It's just a slightly different way of looking at it, maybe. And again, as Mike said, a lot of homelessness is really hidden, a lot of homelessness risk is hidden. So you won't really know unless someone discloses to you that they're maybe at risk of eviction, or they're struggling with their bills or the rent, or if you ask them about it. So that's why this is really about kind of, can we have those conversations a little bit more? And some of the ways that the question can be asked could just be in assessment processes or forms that people maybe fill out anyway. Do you ask about people's housing situation? I would probably not phrase it as, do you think you're at risk of homelessness? Because often people don't think they are at risk either. But there could be questions around, like, how secure do you feel in your tenancy? How are you doing with your, can you pay your rent? And just sort of different ways of kind of getting close to that subject. And there might be organizations that actually have really good existing data where you don't necessarily have to like keep asking people about it, because you might already know if people have received advice maybe around the housing situation previously, or you have data around rent arrears and who's maybe struggling, or council tax. Like, there's lots of ways that both third sector organizations and public bodies can use the knowledge that they already have to kind of try and identify who might be at risk. But I think really importantly, I think for the work we do, and assuming a lot of what you do, is those existing relationships and the trust that you might already have with the clients that you're meeting. So, and that's why I think there's a lot of importance in the third sector, because you might be having different conversations than, say, a GP, as Mike said. They're usually very busy, usually very short time. But actually having those spaces where people can build trust and they start opening up, and maybe then they start disclosing something. So absolutely, the relationships is really, really important. And kind of, people have already come to you with a problem, so it's not completely outrageous to ask a few more things around the situation. And that's what can become one of these sort of reachable moments, where you can maybe figure out that there's something happening beneath the surface that they maybe didn't say at the beginning. And also just, it could just be simple questions, checking in with people, which you probably already do. And it might just be, maybe there's just a little alarm bell that goes off in your head if someone's saying, oh, I don't know, I'm struggling a bit with my rent, or actually I've had to adopt a dog, but I can't have a dog in my tenancy, or like, I don't know. There's lots of different situations that maybe just thinking about what that impact might have on their housing, and not just the general well-being. So yeah, that was my main thing, was like, don't overthink it. No one's expecting anyone to be housing law experts. Like, I'm not, and I work in homelessness policy. Like, there's a lot of, everybody will have their own expertise, but this is very much about the relationship that you have with people already. Next slide, please. And then the tricky one around what might acting look like. And I was a bit annoyed with myself when I was making this slide, because I was like, acting is complicated. And that's not really a very great answer for anyone to have. But I guess what we can say now, and if we think about the legislation, the answer honestly is we don't really know yet, because all that sort of detail is going to be figured out. There's going to be some testing pilots in different public bodies to try and see what the pathways could look like, what the elements are needed to make it work really well. So legislation-wise, that is not clear yet, because the bill hasn't even passed yet, so we don't have all the details. But in terms of like in practice, when you're out there, you're talking to people who might be concerned about the housing situation, I think it's important to think, like, you don't need to have all the answers, but what you can do is think about who might be the right person or the right organization or the right service to help. So in some situations, you might be the action. You might be providing that preventative intervention, whether through, budgeting or money advice or benefits advice. And someone might have referred to you, and actually that's the loop. Or you might think, okay, I need some more like expert knowledge. So a lot of it is going to be in these like service directory referral pathways that you might have, or that exists locally. And most local authorities will have what we call a housing options team, which is a bit more preventative than the kind of homelessness assessment side of things, or a prevention team of some sort. Again, that will probably be a bit more streamlined when the duties come in and the new prevention legislation. But even now that does exist. I've also put a few links to kind of more, I guess, if you want like real sort of housing legislation advice. Obviously, most people will know Shelter Scotland. They are the experts on that, around law, around eviction, around representing people. I don't know if people know Housing Options Scotland. They work specifically with elderly clients, people who are disabled, and people who are in the armed forces or ex-armed forces. And they help finding housing options for those groups specifically. I've also added Clan Child Law, who I've only become aware about recently because I was doing some work around youth homelessness, but they offer legal advice and legal representation to young people. And they actually do a lot of work around preventing someone's homelessness and trying to stop evictions and stuff like that for young people. And they use children's rights as a way of, like, as a legal kind of instrument to try and prevent youth homelessness. So if anyone works with kind of families and children and young people, they're really good expertise. They've got a helpline that frontline workers can call up and get a bit of advice. And then they've got, this link, which we'll send out with them. Heather will send out the slides, links to like how can you get legal representation for someone. So they're quite good as well. But I think one of the challenges with doing like a national presentation is that a lot of this is going to be about the kind of local support that's available in your own area. And I think that's a really, again, key part to make this work in practice is having those kind of hubs or networks or pathways established locally. So I guess kind of I was thinking about like key takeaways, and I hadn't really put it into the slides, but I think my main point is that, you know, we are all already playing a role in preventing homelessness, and this is about maybe making everyone a bit more aware of that, and maybe be a bit more conscious of how they can step in and offer that support, or listen to that person, hear what the story is, what's happening in their lives, and then what other support they might need to be legged into. Not be scared about asking the questions, not be scared about having those conversations, because it can really make a difference if you can step in and circumvent someone, preventing someone from maybe entering the homelessness system, which, as we've all heard, is under quite a lot of pressure. So that was the main thing. I've just got one more slide, but that is more just a bit of a sharing some resources for the Frontline Network in case you think that would be relevant for you. So I guess the Frontline Network is a UK-wide network, kind of like the Money Guiders network. So I facilitate the Scottish one, but there's a whole, like there's a UK-wide team, and then there's local networks in England and Wales and Northern Ireland. And it very much exists to support people who, you know, anyone who works with people at risk of homelessness or experiencing homelessness. So if you're not in a homelessness service, you can still come along, join us. Everyone's welcome. And the UK network has these free training opportunities. So they have kind of like a rolling calendar of free online training that you can keep an eye out on the website. They do sell out pretty quickly, but they tend to repeat the trainings at least a few times over the years. So that's something to keep an eye out for. And they have an annual survey for frontline workers and use that to kind of advocate for, you know, the workforce. And they've got a conference coming up next week on Tuesday, which has a lot of really interesting sessions around LGBT plus homelessness, about women's homelessness, specifically how women's rough sleeping experiences look very different from men, for example, and some things around kind of how can you support workforce well-being. So yeah, definitely worth checking out if you're interested. I'll pop the link in the chat as well. And then I just want to big up the training fund. So I know obviously Heather is offering lots of great training and events to this network, but if you in your organization or your team, if you identify some kind of training that would be really useful for you, the Frontline Network has a training fund. They offer up to £500 for individuals, 1,500 for groups, and that can cover quite a wide range. It is a bit homelessness focused, but if you make the argument, you can probably make the case, as long as you can explain how it's going to help you support the people you support. So yeah, that's just a really good resource. Again, times are tough, budgets are tight, training budgets often the first thing to go. So I just thought I would put that out there. And then finally, they also run a small kind of crisis fund that can give small one-off grants to individuals experiencing homelessness. So it's not much, but it could help a bit towards whether it's like rent, deposits and stuff like that. So I've got a link in there as well, and you can have a look at the assessment criteria. And yeah, and then if you think this is in any way relevant for you, link in with me. Got a mailing list. I do little monthly updates with events and training opportunities. And yeah, that was all. That was the resource bit. So I think we just got to the dog with the question marks now. This actually didn't take as long as I feared it would, but so we got quite a lot of time for questions. So Heather, if we can maybe just stop sharing the screen and then we can just have a bit of a conversation.
Absolutely. And there was some absolutely fantastic content in there, and I think you've really hit the nail on the head by just saying quite simply, don't overthink it, because the worst thing we can do is, what's worse, framing a question poorly but being able to get a response versus not asking the question at all and having those missed opportunities. So that is, I think, a great takeaway in a nutshell. But we've got some time, as Ursula said, we've got some fantastic expertise in the room. So yeah, please, I'd like to open it up for questions, comments, sharing of best practice. This is a fantastic opportunity for us to hear from each other. So if you'd like to, you can use the chat facility by all means, but if you want to jump in, just raise your hand and come in. Yeah, Wendy, please.
Yeah, it's a quite general question, but I have a client at the moment who is, she has a house, but she's private let. Her husband, her and her husband and 5 children are living in a 3-bed house. Her landlord is, well, she's living in dreadful conditions at the moment, and her landlord says if she complains, he'll evict her. So I just wondered if there's any place that I can go to advise her for assistance.
Wendy, can you just clarify what area?
Sorry, it's Dundee.
Dundee.
Yeah.
Okay. Does anyone any advice or guidance to help Wendy for that situation?
Hi there. I think that sounds like an awful situation. I'm really sad to hear that. I think I would be looking at. I think Shelter Scotland would be a good candidate for some support there, potentially on the legal front, but also in just sort of direct liaison with the landlord. There is also a there's a sort of a Scottish legal aid funded provision there. I'm not sure what it is in Dundee, but I'd be able to check that out and come back to you if that was okay.
That would be great, yes.
Yeah. Do you want, have you got would I be able to, I'm trying to think how best I would be able to follow up with you.
I can share your email address,
Yeah,
Mike,
okay,
with everyone,
perfect,
and then
thanks.
Wendy, you could reach out to Mike.
No problem. Yeah, I'm happy to help that.
Way.
Yeah, that would be good, because they're really in a dreadful situation. I mean, she's got a 21-year-old and a 12-year-old sharing a room, which isn't ideal. But
No.
as I say, the living conditions are awful. She's got rats, mice, all the rest of it. And our landlord has been very, very aggressive and just, like I say, threatening to evict her if she makes any complaints.
We need to get something done about that. That's awful.
Yeah.
Yeah.
Yeah, and definitely, I know Shelter Scotland works in Dundee specifically. I'm pretty sure they have a wee office there as well. So they might have some of that local knowledge. But yeah, that is, and I think that's the thing. That's when policy and legislation falls short, is when you because there is protections against that. He can absolutely not do that, the landlord. But it's just, how is that enforced? What kind of support is there available for people? And what you often see is that folk just end up leaving the tenancy because they feel so like they feel threatened and they don't feel safe and they feel like they'll lose the house anyway. So yeah, no, absolutely. Thanks for raising that, Wendy.
Yeah. I just feel so helpless, that I know the situation's going on, but I'm not sure how to help her, which is why this came up today, and I just thought, superb, I'll ask a question,
Thanks very much, Wendy. Yeah, and let's hope that there's some support there, which there is. Yeah, just to get that family to the right people who can help support that journey. Any other kind of questions, comments from the group? I do have a question if no one does, and it is to the group. Is hands up, do you feel confident, in your own ability and willingness to ask a question or a question around homelessness? So hands up if you feel quite comfortable, quite confident in putting yourself out there and asking those questions.
Yeah.
Okay. Excellent. A follow-up question then. I can see lots of hands raising. Great. And then Jacqueline, absolutely. The presentation was so thorough, you don't have questions. Okay, so you feel confident, comfortable. Is there anything that you think could be done? You might not have the answer to this, but do you think there's anything that could be done that would increase your confidence further? Or maybe your colleagues that you work with, have you identified or seen any you think, oh, we could do something here, there's room for improvement or development? Debbie, your hand's raised. I don't know if that's from earlier or you'd like to come in.
Apologies, that was just from earlier.
That's okay. And what about yourself, Jacqueline? Is that from earlier or have you got a wee question or comment? So examples of good practice from other areas. Okay. Is that just more to the group, Jacqueline? Or are you looking for some ideas, suggestions, or what's worked well, not well from people in the room?
I just think that would be really helpful to see because you'd mentioned that there is already good practice going on, and I can very well imagine there is. So I think it's just about sparking ideas and thinking, because that hospital one, I mean, I don't know why everybody can't be doing that.
Absolutely. Thank you, Jacqueline. Sorry. I think that's a really good point. I know, so Crisis made like a big kind of guide a couple of years ago called 75 Ways to Prevent Homelessness. And some of the projects might be a little bit out of date, but I'll find it and put it in the link as well. And that was very much about trying to map out examples that is happening across the country. But I think, yeah, there are really good things happening, and some of it is not that difficult either. Some of it might be having benefits advice available in hospitals, or some of it might be around like co-locating services in a way where if people come for a problem with their rent, they might also be able to get links to other support service. But yeah, if you reach out, I'm happy to kind of compile a bit more as well. But I'll find this report just because I know that's one way where there's quite a lot and it's quite structured in terms of different settings as well. So that might be an interesting document to have a look at.
From my point of view, I think some of the work that goes on around about helping people who are liberated from prison in some of the different local areas, I think the WISE group and SACRO do quite a bit of work on helping people to prepare for housing upon liberation. And equally, there's quite a bit of work that's done with people prior to incarceration, because if that work isn't done well, then what people can come out to is a world of sort of housing arrears, rent arrears, that actually have quite a big impact on their ability to access housing again in the future. They kind of trap them in this position of homelessness. So I think, as sort of Ursula was mentioning, it's a roundabout where some of the institutions are, and trying to link those up a little bit more, almost where third sector organisations are kind of being like a bridge between, say in our case, hospital and housing, or maybe between prison and housing, then that's where we see a lot of people falling through the gaps. So that's where I think there's some good practice going on.
Excellent. I'm going to ask Anne, so I'll come to you next, Graham, but Anne, you had your hand up before. I just wanted to see if you wanted to jump in with anything.
Hi, I know, Heather, it was just, we were just agreeing that there's always room for, like improving and learning. And just what I think it was Jacqueline that was saying, we were talking about that as well, about the health, like about the hospital. That's excellent. It's just a pity it's not all over, like at the moment, because we find out just working ourselves with certain people, and again, it's coming down to having conversations and just listening to what they're saying, because they might not actually come right out and tell you the whole story, like for whatever reasons, embarrassment or, like fear, whatever. But it would be good to have a lot more connection with everybody else, involved. Yeah, that's what Lauren and I were both just talking about.
Absolutely. Excellent, thank you for that. Graham, I'm so glad you put your hand up, because I was going to pick on you anyway, just because if you haven't seen in the chat, folks, Graham put in a wee message for anyone who's working Edinburgh based, but I won't steal the thunder. Jump in, Graham, please.
So I actually had the question first as well, Heather.
Okay.
For Ursula, it might be a bit because in relation to the Scottish Government have got pilot schemes on the go for Ask and Act. So it's just to see if Ursula and Mike were involved in any, because one of the concerns from local authorities is, this is getting maybe a bit technical within the bill for Monday or Thursday afternoon, but the bill says that it shouldn't just be a referral into local authority housing teams. It should be that team or, that relevant body doing something within their remit. But the bill also has a contradiction that says they're not expected to be housing experts. So where does the line draw there? And I was just wondering if you're interested in you were doing any pilot schemes which are kind of exploring that dynamic, but I appreciate you might not be able to say on this forum and things like that, but that's my question, essentially.
Okay, I'll maybe come in first if that's okay. I couldn't agree more that I don't think this is ever going to work if it's just about adding even more workload to the local authority housing teams. I don't think, I wouldn't like to see it working like that whatsoever. I think it's got to be a much more innovative approach and trying to build on what the sort of the relational capital that the other sort of the third sector organisations maybe have that are sort of community anchored. I think the example that I gave with the sort of the hospital team, although it does still have some contact with the local authority around about housing access, still takes quite a lot of the work away from I guess overburdened housing teams. So we haven't seen an opportunity to get directly involved in the pilots yet, but I think we would be really keen to do that. But yeah, I couldn't agree more that it's definitely not about just adding to the queue that is already out the door.
Yeah, no, just reiterating that, Graham, and thanks so much for coming in as well and joining today. And I think, yeah, it's one of the things that kind of whenever we're doing any type of influencing around this bill is that we keep repeating that it's not about adding a bigger workload. It's about catching things before it actually needs to go to the housing team, and some of that might be around like, there might need to be more of that preventative support in place, but I think it's going to have to be quite like a local approach around having those like networks in place but I think it's going to be like a long term, like, imagine it's working in 10 years, not in 2 kind of thing, because I think it's a massive culture change as well, because if you're asking busy workers and other public bodies to kind of suddenly start asking about housing and homelessness, it's a really big change. But at the same time, I think some of it, don't overthink it about having the question, but I think what is going to be key is having those networks and referral pathways and everything. But yeah, I absolutely agree that the way the bill was phrased, especially at the beginning, was very much like, oh yeah, just refer to the housing teams, and we were not very happy with that at all. So yeah, thanks for sharing that. And what did you put in the chat? Sorry, that Hella had highlighted.
Yeah, so basically my role at Edinburgh Council is Prevention and Partnership Officer. So basically I'm employed to kind of look at the housing bill and go out and deliver workshops and various sessions to third sector organisations, all the relevant bodies, so that's healthcare, social partnerships, registered social landlords, and just give them a wee heads up that this is coming, a bit like what you're doing today, essentially giving them a bit like Ask and Act, but have a much more Edinburgh-centric approach and give them information about housing teams that we do have that we're able to help, like a private rented sector team, a early intervention team, and just things that you might notice, again, like what Mike was doing with his examples of how homelessness might start, like how one person, so for example, it's all about if somebody's got a energy payment, comes to you for a crisis payment to cover their gas that week, but then it's back again the next week and come to your service, you should be stepping back and being like, right, okay, what is the root cause here? Why do you keep coming back? Because there's something fundamentally not right. And that sounds, as you say, asking that's really simple and straightforward, but just the legislation makes it sound really complicated. So if anybody's Edinburgh based and wants to have a bit more of a chat, just feel free to reach out to that email address I put in. So yeah, I'll shut up now. Thanks very much, Ella.
Oh, thanks for coming in, Graham. I must say, I'm loving the chat here, and there's been folks who've dropped in some different resources that are useful. So yeah, that goes out to anyone and everyone. If you've got any information about your service or you've come across a useful resource, please do share it, because if you found it useful, there is going to be loads of people who are also going to find it useful. And that is like the bones of a community practice. It is that kind of shared learning, because we're all here with a shared purpose, aren't we? It's to help people. You're dedicated, you're committed in your roles, but they're not always easy roles, are they? We come across challenges every day. And that's what we're here for. So as much as we all may work for different organisations in different areas entirely, we are effectively colleagues. We are peers in this space. So please do know that you're not alone in the work that you do. You've got not just the people in this room. I think we're at 18, almost 1,800 members in the Scotland network, but there's also the UK network of money guiders, so we're a community that stretches far beyond Scotland. So yeah, I think this will be my little way of saying a wee gentle reminder of you're all doing incredible work. Don't do it alone. Rely on each other for support. We're all here for that. And on that note, I've just a wee check. Is there any other questions or comments from anyone before I let you know how we can keep conversations going? I don't think so. Okay. Similar, so we'll share information about the Scottish Frontline network, as Ursula said, because if you're in the homelessness prevention intervention space, or you think you are, it's a fantastic network to be involved in. There's of course the Money Guiders Scotland network, and yeah, let's keep these conversations going. If you're not aware, our community hub uses its knowledge hub. If anyone's familiar with that platform, we call it our community hub, and that's a place where today's event recording will go, resources, and we're building in the wiki pages, we're building kind of links to lots of organisations and their resources that they offer, because there's incredible resources out there that people like yourselves have worked on. So we're kind of using it as like a central repository almost for what is happening within our network with events, useful guides, resources, but there's discussion forums too. And I will be honest, they're not too actively used at the moment, but I think they really could be. It would be a fantastic way for us to share best practice or just ask questions, particularly if you're maybe someone who's working in a service or project where there's not many of you. I certainly know there's a few projects where you're the only person, apart from maybe your line manager, who might not have technical or practical knowledge that will be helpful. So use the discussion forums as a way to reach out to peers like everyone in this room and beyond, to ask those questions. We've also got our signposting guide, which those signposts that you mentioned are sort of like clan child law housing options. I've never heard of them before, so I'll absolutely get them updated in our signposting guide. So if you're an organisation providing support, you probably want to find your way onto this guide. That's exclusively on the community hub, just because it's a live document and we don't want to have too many versions of it going out when we know that services can change and information become outdated quickly. But listen, you've got a few minutes, so hopefully that means you're not going to go on to do work. Take the extra 6 minutes, claw it back, take that 6 minutes of your life, grab a cuppa, just decompress. But a huge, if I can, huge wee round of applause, virtual or auditory, for Ursula and Mike. Thank you so much for making time today and sharing your expertise. And dare I say, an even bigger round of applause to you guys for your incredible work, but also for making time out of your incredibly busy days and weeks to come to this session. Thank you so much. I will share everything in an email as well as a link to feedback. It's super important that we get your feedback, folks, for a few reasons. We need to know what it is that you want from the network from a learning and development perspective, and it also helps us understand, what are we doing well and what we can do more of. So if you can take a minute out your day when you receive that email and the link, or use the link in the chat, please do give us your feedback. But sorry, I'll stop talking. Please fly free, everyone. Enjoy the rest of your week, and I'm really looking forward to seeing you at our next event, whether that's in person or online. But until then, take very good care of yourselves.
Right. Thanks, Heather. Bye.
Thanks, everyone.
Thank you.
Thank
Bye.
you.
Bye.